Now, according to the World Health Organization, cardiovascular diseases are said to be a leading cause of death in adults, not just here in Kenya, but worldwide. Now, that's our focus today as we look at what to do at home in case of a cardiovascular emergency. We are looking at cardiac arrest, heart attack, or a stroke. My name is Aida Munzatsi. Health Nuggets starts now. Well, as mentioned, we are looking at what to do at home in case of a cardiovascular emergency. We are just focusing on cardiac arrest, heart attack, and a stroke. And that's exactly what you're going to learn on this episode of Health Nuggets. And I'm being joined by Jason Kiruja, who is just going to take us through the three cardiovascular emergencies. Thank you so much, Jason, for your time.
Okay.
And we look forward to learning from you.
Okay, thank you for this opportunity. Yeah, so you're going to learn about the things we can do at home as we seek advanced help, even before we get to advanced help.
All right. Now, before we look at now the cardiovascular heart attack as well as a stroke, let us just first of all just define what are cardiovascular diseases.
Okay, so the cardiovascular diseases, the three you've mentioned, the heart attack, cardiac arrest, and stroke, they all have problems with the blood vessels. So the blood vessels get narrow, a clot forms when they call it the plaque forms on the blood vessel, leading to clot formation. So that clot can cause the blood vessel to have a complete obstruction, or the clot can also be dislodged and go to another part of the body. So for the heart attack is the limited supply of the blood to the heart muscles. Heart is a muscle and it gets constant supply of blood. So when you have these blood vessels within the heart getting narrower or even getting an occlusion, then you'll have a heart attack. So the heart attack can either present over time or immediately. The cardiac arrest is a problem of the coordination of the beating of the heart. We call it also it's an electrical system. So when you put a patient on a monitor, you usually see the recording of the heartbeat. It's supposed to be an organized step of the way the heart beats. So sometimes it can be chaotic, as we're going to see during the demonstration.
That's for cardiac?
For the cardiac arrest.
Okay.
So that one requires a different kind of approach where you immediately start the CPR. So for the stroke is also the limited supply of blood, but now to the brain. So you've seen the heart affected, now to the brain. So you can have limited supply of the blood to the brain. So there are two main types of stroke, which we are also going to explain about.
All right. You mentioned that a heart attack is something that happens over time, right? Now, for cardiac arrest, does it also happen over time, or does it just happen?
Cardiac arrest is immediate. Okay. It's usually quite immediate, and good to discuss the two at the same time, because quite often the heart attack leads to cardiac arrest. So if treatment is delayed, sometimes even with the right treatment, the patient can still get into cardiac arrest. So the heart attack can lead to the disorganization of the heart getting to the cardiac arrest.
Okay, now just going back now to a heart attack, what are some of the telltale signs that they come with now that you're talking of? They happened gradually, like probably a day after a day, or months or weeks?
Yeah, so it's usually as the blood vessels get narrower, so the signs will start. The main sign is usually the chest pain. So when the heart is not getting enough blood as it gets, so that presents with chest pain. So this chest pain usually can come when you do something exerting. So maybe you run or you walk the stairs or you do some heavy work. So you can get that feeling of the chest pain. So then, yeah, that can happen over time. So, and then sometimes even the pain is when you're resting. And also the heart attack can also happen immediately. Okay. So the clot forms immediately and you get the signs immediately. So the one which at least occurs over time, it's like it's warning you, you need to get help. So the one which occurs immediately is where now you also have to do some first aid measures even as you rush to the hospital.
Okay, now before we look at the waves as you
Yes,
put it now on the monitor, we have risk factors, because you're talking about the arteries, you're also talking of the heart. What would you say are the risk factors for now a heart attack?
Okay, so there are those which we can modify, there are those which may not modify, like age. Yeah, so the genetics. So those are the two main ones which we may not do much about. So, but the ones which you can modify is the weight. Yeah, so the BMI should be within the normal age. So we'll have more obese people getting more incidence of. Yeah, so that doesn't mean also those who are not overweight do not get. Yeah, so it's just the probability. The risk is higher in people who are a bit overweight. So smoking is also increases the risk of heart attack. Increased alcohol consumption also increases the risk of heart attack. Sedentary lifestyle. They say now sitting for long duration is as bad as smoking. Yeah. So sedentary lifestyle. So and that's why we exercise. We are encouraging exercise at least, or encourage at least 30 minutes of activity every day reduces the risk of heart attack. Yeah.
Okay, so basically it's just lifestyle.
Yeah,
let me lifestyle. All right, and now let us just get now to the monitor. Maybe you can just let us know, because a number of us only see these ones in movies or in hospitals, and probably you do not understand how the waves looks like. So for a heart attack, just for a normal, like a heart condition, how do the waves look like? And for now a heart attack, how will they present themselves?
No, usually, yeah. So the cardiac arrest. So we can have so the normal heartbeat usually has the way you see the waves. So they're usually numbered P, Q, R, S, T. Okay. So the P is the smaller one, then the taller one, then the T, then you start all over again, P, Q, R, S, T. So that's the way the normal organized heartbeat looks like. So when you go to the hospital, you usually get a printout of a printout looks like this. Okay. So that shows you the normal ECG, the way it looks like. Okay. So if you have a heart attack, usually the changes the doctor is able to see on the monitor. Okay. So it usually will not be normal. So some of the waves will not be as organized as they are supposed to be. Okay. Yeah. So that's what the doctor checks. So usually, like immediate cardiac arrest, there's a small part here between the S wave and the T wave, which is usually higher than normal or lower than normal. So that's why you see the ECG. So this becomes a very important diagnostic tool for, in case of somebody is having a heart attack, to see if there is any changes. That's because there are other conditions that also cause chest pain. Yeah, so maybe to distinguish between the heart attack and these other conditions like hyperacidity, so you can be able to, anxiety, so you can be able to distinguish between the two by doing the ECG, electrocardiogram, and also by doing blood test. So the disorganized one.
So the disorganized one will still be for a heart attack?
For the cardiac arrest.
All right. Before we go to the cardiac, let us just look at what to do at home in case of a heart attack, just before we move to a cardiac arrest.
So what to do at home in case somebody has the signs of heart attack is to get the first medication you can take is aspirin. Aspirin is quite available in many, even the shops. can be bought over the counter, is a medication that is quite available. So the recommended dosage is 160 milligrams to 325 milligrams. That is like 1 adult tablet or 4 junior aspirin tablets around there. So then the other important point about this aspirin, you need to chew. Don't just swallow with water, you need to chew so that it can be absorbed quickly. So by this time, you're ideally you need to call an ambulance when you start feeling these signs and as you take the aspirin or as you rush to some ambulance access in many of our estates or homes can be difficult. So usually people will get the available vehicle and rush to the nearby hospital. So as you rush to the hospital or as you get the ambulance, then you need to take the aspirin.
So at what time am I taking this aspirin? Like how will I be feeling in terms of the symptoms? Because probably I may just start sweating and someone is like, oh, this one is now a heart attack, let me take a aspirin. Or
yes, so you see the heart attack will have all these signs. You will be sweaty, you will have the chest pain, not all, maybe, yeah, and then usually they say the patient has that feeling of an impending doom, like something bad is about to happen. Yeah, so all this is combination of signs that can be able to trigger that this person could be having a heart attack. Then they chew the aspirin tablets. Yeah, so then the other medication that follow, they are best done in an ambulance or in a hospital.
All right. Let us just, before we take a very short break, let us just look at now a cardiac arrest. You had mentioned of what it is. Just show us probably on the monitor how the waves will now look like. Then we'll take a break. Then now come back with the now solutions at home.
Yes. So we are lucky to have this simulation lab. So these are simulation lab that try to mimic as much as possible what the patient will look like away from the patient. So when you get into cardiac arrest, a common rhythm that happens is this one. We call it ventricular fibrillation. It's just chaotic. It's just chaotic from start to finish. And the main treatment for this rhythm, when it appears like this, is as you start CPR, also the patient gets the shock. You've seen in the movies, people say clear shock, yeah? So it's usually due to the patient who present with such a rhythm. The main treatment is to give that shock. So since this shock is required immediately, I think technology is advancing. And then maybe in a few places, public places, where there's a first aid kit, you can also be able to see a gadget which is called an AED. So we're encouraging all public places, maybe airports, malls, churches, schools, to have the AED gadgets. They're called automated external defibrillator. The one you see healthcare workers using to, doctors or nurses using to shock, is called a manual one. So this one is an automatic one. So this one talks to you. So even if you're not medical, it talks to you what to do. And then it analyzes the rhythm and tells you to shock. And you just press the shock button and it shocks the person. Yeah, so it's a gadget which we're encouraging institutions to have, to buy and put where this accessible, where first aid equipment is, in case you get somebody who gets into a cardiac arrest. So that will be the main treatment.
All right, now for a cardiac arrest, are there any signs?
So it's just the immediate collapse, and you call somebody, you tap and call, and they are not responding. And then when you check their pulse, they'll have no heartbeat. So that will be cardiac arrest. Takes a few seconds, less than 10 seconds, to determine if somebody is in cardiac arrest, because you just need to feel for the pulse for less than 10 seconds. If you cannot feel the pulse, then you start immediate CPR.
All right, so we'll just be looking at what to do at home. Definitely, that is the CPR, as you put it, in a very short while. For now, let us take a very short break. Remember, we are looking at cardiovascular emergency, just what to do at home in case of a cardiovascular emergency. We are looking at cardiac arrest, heart attack, and a stroke. So we take a very short break, but remember, if you have any question as far as what we are looking at today, just feel free to drop it. That is via our SMS number 0111220044 or through Facebook or YouTube, that is CAC TV Kenya.
The journey of 1,000 miles will always start with a single step. We began here. And now we are here, bringing you the first ever show on matters environment, this and every Tuesday from 8 p.m. Join Ida Monzatsi live as she hosts the moderator of the 23rd General Assembly, together with the Deputy Director of the Kenya Forestry Research Institute, as they focus on environmental conservation. You don't want to miss, for an aware society is the best weapon to climate change.
Welcome back to Health Nuggets. If you're just joining us, we are looking at what to do at home in case of a cardiovascular emergency. We are just looking at a cardiac arrest, heart attack, and a stroke. And definitely, if you're just joining us, you can always just follow up the conversation on this. Now, just on earlier on, we were just looking at a cardiac arrest. Yeah, and you're just trying to explain to us probably what to do in case of a cardiac arrest that's at home.
Yeah, so we said in case of cardiac arrest, where this person was just, maybe sometimes even somebody was just okay, then they just suddenly collapse. So usually you confirm that they are responding. If they are not responding, then usually check for the pulse. So if you cannot feel the heartbeat for 20 seconds, then you just go to the center of the chest and start the chest compression.
All right, so we now bring in Frederick, who is a nurse. He's just going to help us now with the CPR.
Yeah, so once we've confirmed the person is not responding, and you check the carotid pulse, and you cannot feel the heartbeat, so usually do from the windpipe, go to the groove to the side of the windpipe, and you should be able to feel the heartbeat. If you cannot feel it for 10 seconds, then you'll go to the center of the chest and do 30 chest compressions. So you want to compress at a depth of 5 to 6 centimeters. So it's not a massage, it's an actual compression, 5 to 6 centimeters. So with the compressions, we are doing 30 of them. Then you do 2 breaths after the 30 compressions. So 30 compressions, 2 breaths. So at home, you can do mouth to mouth. So in the hospital, you usually use a bag valve mask device. There's the bag they call the commonly called ambu bag that we use to ventilate the patient with. But at home, you can be able to do the mouth to mouth, or you can use a barrier device. So there's a pocket mask. There's also some simple. They look like a plastic bag with a slit to just offer some protection.
Okay, and I have also noticed that Fredrick is like on a raised ground.
Yeah. So at home, you need to put the person on a flat and firm surface. The best could be on the floor, so that you're using your upper body weight to do the compressions. Because you said you're compressing for 5 to 6 centimeters. So to be able to do that, you need also to apply your weight. So that's why is on a step stool, so that to gain that advantage of using your own upper body weight to be able to get the compression. Then we are compressing at a rate of 100 to 120 compressions per minute. So it needs to have that rhythm of 120 per minute. So there are very many apps available on Play Store or App Store. They're called CPR metronomes. So it just gives you the beats. So the app gives you the beat of 100 to 120 beats per minute. So it goes with this rate of 100 to 120 beats per minute. So we used to have that song of Staying Alive as we do the compressions, because it has 100 beats per minute. But now we have a simple metronome that can be able to do the 100, can be able to give you the 100 to 120 beats per minute.
All right. And now as he blows through the mouth, he keeps checking like the chest. Yes. What is the importance of that?
Because that's what confirms to you the air is getting into the lungs by watching the chest rise.
Okay.
Yes.
Okay, so you're supposed to do this for how long?
So for every 2 minutes, but you have also called for help.
So you do this while you've called for help?
At home as you wait for an ambulance.
Okay.
So the sooner the ambulance arrives, then the ambulance team can take over. So the ambulance team then can also come with the gadget, like we said, the AED gadget. So which the only thing that you need to know how to do is to switch it on. So once you switch it on, it gives you the instructions on what to do.
Right.
Apply pads to patient's bare chest.
Yeah, so it gives you all the instructions on what to do.
Light.
And it has diagrams on where to place every item. Okay. So it's...
Apply pads. Plug in connector.
So yours is to only follow whatever you're being told?
Yes.
All right.
So it explains to you everything that you need to do.
Analyzing heart rhythm. Do not touch the patient.
Okay.
Shock advised. Charging.
Yeah, because it has detected the abdominal rhythm.
Okay.
Deliver shock now. Press the orange button now. Shock delivered. Paused. Start CPR.
Okay, then it guides you. So so it gives you all the instructions that you need.
So like whatever is happening here, is it being shown on the monitor as well?
Yeah, so because at home this will be like the monitor.
Yeah.
It's analyzing for you, comes either with the ambulance team, or if it's in a public place where you have access to one, anyone can be able to use the AED, the automated external defibrillator. So anyone can be able to use it in case of a cardiac arrest. So they are meant for anyone to use, and usually this is a training one, but the actual one delivers a shock to the patient, and you'll see the patient jerk when the shock is delivered.
Okay.
So every 2 minutes you reassess, and you want the ambulance to arrive as soon as possible.
Okay. So definitely, as you do this, you also count.
Yes, you count so that you are doing 30 compressions, 2 breaths. 30 compressions, 2 breaths.
So, and just to be clear, this is for an adult?
For an adult, yes.
All right.
Yes. Okay. And then maybe another point we need to remember, sometimes, as you said, you may be in a place where you're not feeling safe to do mouth to mouth. Okay, so thank you, Fredrick. So you may be in a place where you'll not be able to do mouth to mouth. You can do only chest compressions only until advanced help arrives.
Okay.
So you just call it hands-only CPR. You're just doing the compressions non-stop until more help arrives. Yes.
All right.
So that means you can always do something in case of, and it has been shown to save life. Yes. So where somebody just do the chest compressions only.
All right. So just probably just as a recap, I know it's
Stop CPR.
Okay. So those are 2 minutes. It prompts you to stop, recheck the patient, stop, recheck the patient.
So every time you do that, after 2 minutes, you check on the patient.
Yes.
After 2 minutes, you check.
Yes.
All right. Probably just as a recap, you've said just what to do before you now start the chest compression.
So you're usually confirming that the person is the person who suddenly collapses. You are tapping and calling just to confirm that they are not responding.
So calling them by name.
By name. So this one, our person is called Anne. So you just tap and call Anne loud enough so that they can hear from both sides of the ears. So if they are not responding, then you call for help.
Okay.
So you may need help, so you call for help.
Okay.
So either way, such a person who has just suddenly collapsed, they are not responding to a call, either way they'll need help. So it's also the time to call for an ambulance. So somebody can call an ambulance service, our E+, our 999, or the nearest ambulance to you. So we encourage people to have some contact of an ambulance service near you, because so that you can be helped to even somebody you see just collapse even along the streets. So just get some contact on your phone of the available ambulance services, Red Cross, that's the E+, St. John, or even the hospital ambulances. Once you've called for help, we also always ensure that you're safe. Okay, that was also supposed to be the first step, so that you don't endanger yourself. Okay, so once you are safe, we call out the person and they are not responding. You've called for help. Then, as the help is coming, we check if you can feel the pulse. You can feel the heartbeat from the carotid pulse. So for 10 seconds or less. So for 10 seconds, you cannot feel any heartbeat, any pulsation, any heartbeat. Then that's when you're starting our CPR with chest compressions.
All right, thank you so much for that. Now, that was in case of a cardiac arrest at home, yeah? Now let us look at this other cardiovascular disease, that's the stroke.
Okay.
Yeah. How does it manifest first?
So the stroke, we have the American scale that you used, the Cincinnati pre-hospital scale. It has only 3 signs. So you can look for facial droop. And facial droop, it's easy to remember, FAA. So facial droop, arm drift. Arm drift, you tell the person to put up their arms, and you notice they are not, and put them on the same level. So person with the stroke, one arm will be lower than the other.
Okay.
Okay.
And for the face drop?
For the one side of the face, mostly the mouth or the eye on one side will be affected. So usually the mouth, and they could be even drooling saliva from one side of the mouth. So that's the facial droop. Then the other one is abnormal speech. So they'll not be talking the way they normally do. So they'll either they'll not finish sentences, or their speech will have changed in one way or another. So if you have the 3 signs combined, the chance that you have stroke will be 85%. Yeah. So if you have maybe one, the chance you have stroke is, I think, about 73%. Yeah. So it's quite a sensitive scale, so that it's able to pick people who have stroke. So once you notice,
you've said FAA.
Facial droop, arm drift, abnormal speech. Yeah. So if you have the 3, you check the 3. So talk to the person. Yes. Especially at home, is somebody you know how they talk. So if you're talking to them and they are slurred in their speech, okay, maybe they are saying they are not able to complete sentences or such, then you can be able to tell something is wrong. Then arm drift, you said you tell them to put forward the arms and see if they are at the same level. and then you said about the facial droop. Yeah, so it's usually they'll have weakness on one side, they cannot support themselves on the other, on one side. Okay, because usually a stroke may affect one side of the brain, and you'll know the problem on the opposite side of the body, which the brain controls. Okay, so those are the signs of stroke.
Okay, and anything that we can do at home in case
So
that
what
happens?
we can do at home, the major thing to do at home for stroke is recognizing and taking action. So that is the main thing you can do at home for stroke. Yeah, so be able to recognize somebody is having a stroke and starting immediate help. Don't waste time, start immediate help. Because we are told time is brain. So don't waste time.
So that one, I mean, that can only happen in the hospital?
Yeah, so as you also get help, stroke management is done in the hospital. There's so little you can do.
The most important thing is just to identify
identify and take the immediate action. That's what you can do at home. So the rest happens in the hospital. And then now that you're taking action at home, and if you're able to call an ambulance, the ambulance team will know the best hospital to take the patient. The hospital that is really needed is the hospital which is able to do a CT scan immediately.
It's also identifying the hospital that you're supposed to go to.
Yes, that is quite important, identifying the hospital that you need to get the patient to. And one of the major capabilities for the hospital that you want to go to is CT scan. Not just CT scan which can be done within a very short time. The hospital may be having a CT scan, but or the person to do the CT scan is available once a week or such a thing. Yeah, so it's the hospital which can be able to do the CT scan within a short time. Okay. Yeah, so that can be a challenge in many of the towns, but maybe in Nairobi here, several hospitals are able to do, the major hospitals are able to do the CT scan within 20 minutes of arrival to the hospital. And that CT scan is reported within 45 minutes of arrival to the hospital. That means it's quite quick. Okay, so why the CT scan? So the CT scan is able to distinguish to us if the stroke is due to a ruptured blood vessel or due to a clot. So you have the two main types of stroke. Either it is due to a bleed or due to a blockage of the blood supply. So either there's a bleeding. So if it's bleeding, then it goes to the neurosurgery and a different pathway. Then if it's a blood clot, then there are medications to be given. So that's why the CT scan is very important to distinguish which type of stroke that you're dealing with. So because the medication is supposed to be given ideally within 3 to 4.5 hours of the symptoms starting. Okay, so that window closes very fast. That's when you get the most benefit, when you give within 3 to 4.5 hours. So that's when you get the best benefit. So it can even be given up to 6 hours later, but the best benefit is within 3 to 4.5 hours. So that's why time is of essence. So you don't want to go to a small facility, then you get referred to another facility and another. So that wastes time
as well.
Yes. So you want to go straight to a hospital which is capable of handling stroke patient, or at least doing an immediate CT scan, and you're able to tell, is it due to a clot? Is it due to a bleed? Majority of the stroke are due to clots. Okay. They call it the ischemic stroke. So majority are, this even close to 87% are the ones due to blockage of the blood supply to the brain. So that means they'll benefit a lot from the medications that are given to break down the clots. The same medications are given in heart attack. Okay, so in heart attack that occurs immediately, we didn't mention this, you need those medications. They're called the fibrinolytics. They break down the clots so that the blood supply can continue again. So even in heart attack, time is also of essence. because they're supposed to be given within 30 minutes of arrival to the hospital. So also time is, and some of the hospitals, especially in Nairobi, they are capable of doing that within the stipulated time. Yeah, so that you're able to get the medication, and also get to for the heart attack, you are also able to go to the, call it the catheterization lab, cath lab, where they do the opening. They put a balloon to open up the blood vessels and restore the blood supply to the heart muscles. Yeah, so that is also capable in a number of hospitals.
Okay, now for a stroke, very briefly, you've mentioned of time being of essence. Now, when treatment is administered within the number of hours that you've mentioned, what are the chances of me or this particular person regaining speech, as well as the facelift, as you mentioned, and the arm? What are the chances?
Chances are very good. So if you have recovery even in terms of even more than 80% time, yeah, so given that time, the recovery is almost guaranteed. So if you get the medication within the right time. So yeah, very good outcomes, and we've had stories of people who presented with the signs, with the right environment, and they are able to, yeah. So maybe we have some patients we can refer you to, so that they can give their story also.
Okay, all right. Now, any other thing that you'll want to add? Especially, let me talk over, we've looked at, there are emergencies, but of course there are ways that we can prevent these emergencies from happening. You've just mentioned of stroke, cardiac, them being, let me call them lifestyle conditions. Yeah, so anything that you'll want to add?
So we've talked about nutrition, exercise, and we said some, and also I think also very key, we say there are those things you cannot modify, like age, the genes, the family history, the likelihood. So there are those which you cannot modify. For those is seeking early treatment. Okay, so if you know there's that family history of these conditions, then the best thing is to seek early treatment, and also maintaining the healthy lifestyle.
All right, thank you so much for that. It was very helpful. Of course, I've also gotten a chance to also learn especially over the CPR. All right, thank you so much for that. Well, that's all we had for you on this episode of Health Nuggets. I hope that you've been able to learn something, especially on what to do at home in case of a cardiac arrest, heart attack, as well as a stroke. Definitely with the help of Jason Kiruja, we've just been able to see what exactly we can do in case of a cardiac arrest, in case of a heart attack, as well as a stroke. Remember, with the stroke, as he says, it's just a matter of you understanding and just looking at the signs. For a heart attack, it has to do with the aspirin, and for a cardiac arrest, it has to do with the CPR. So thank you so much for tuning in. In case you're just joining us, you can always go to our social media pages just to get to learn with us. My name is Aida Munzatsi. As always, your health matters.